You ready?
Yes.
Okay, here we go. Well, hello guys. This is Jim Morgan with Kerryn Transitions and Life's Copilot, and we actually created this Life's Copilot as a means to get information out to our seniors and our seniors' families and caregivers and stuff for free. And today, I'm really excited about having Pamela Perkins, and I didn't write it down. What was your name?
Kerryn.
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 Okay.
Yes.
Who are specialists in Medicare, and I'm going to let them talk to you because Pamela was at the Marion County Council on Aging, meeting, and was talking to us about how there's a lot of changes coming to your Medicare this cycle. So I want them to kind of give you a little bit of a heads up what to look for. In other words, pay attention to the sheets that are coming in the mail to you because it's going to be worthwhile to pay attention. So I'm going to have you introduce yourselves and who are you, where do you work, what's your your companies, all that kind of good stuff, and then tell me a little bit about this whole what's going on in Medicare.
Great. Thank you, Jim. I'm really grateful that you are allowing us to come on this morning and to share with your audience about Medicare. Today, my hat is working with Marion County Coalition of Aging, doing an educational event. Well, we're just talking straight Medicare. So we're not specializing or talking about any particular carrier or prices or anything. We're just going to get into the weeds, as they would say, on Medicare. I am a licensed agent. I represent several companies. I'm carriers. My name of my company, though, is A Life Love Legacy. And I do specialize in health and life coverage. Medicare was one of my specialties. And then I have my friend Kerryn here.
Hi, my name is Kerryn. I'm with All You Need Insurance. I am also a licensed agent, licensed broker. Work with multiple different companies, so can find the best plan for someone. But today we're just here for educational purposes and to open up some information about Medicare, which can be pretty confusing. So having someone to walk you through it makes it a lot easier.
It does indeed. I've been there for a couple of years now, and it is, I make sure I always have someone guide me through the process, what drugs, the best programs and all that kind of stuff. So tell us what's going on. So you guys were kind of putting the red flag out that changes were coming.
Yes, that is true, Jim. We wanted to say Medicare review upcoming changes. Also, we have a handout that we're going to provide to you after the presentation so you can get it out to your audience. But we're talking about Medicare review and the upcoming changes for 2025. But first of all, we want to get started and just talk about Medicare in general. Some people don't even understand Medicare in itself. It could be in itself very confusing. There's options that you have when you first turn 65 or go on disability for whatever reason, end-stage renal failure or disability, where you can actually qualify for Medicare. And then you have several different parts. People know the A, B, C, Ds of Medicare. Starting off with Part A of Medicare is actually a hospitalization. Even though it's at no cost to you, there are deductibles. So there are charges that you have to be exposed to as well. Then there's a Part B. Part B of Medicare is talking about your hospitalization and other type of charges that would be Part B of Medicare. And you turned over to page number 7.
Mm-hmm.
Okay, we're going to show you page number 7 that talks about the different plans and different things. So when you start taking notes, guys, and then when we come and get you the actual form itself sent over to you, you'll know where we're at. Okay, so we got the original Medicare A and B. And what happened was when you first do original Medicare, people think, oh, I got Medicare, it's all cool, I'm all covered, I don't have to worry about. Well, actually, Medicare, even though Part A is at no cost to you, there are deductibles that need to be met first, and that's the hospitalization part, before Medicare actually kicks in. And then the Part B, there is a cost for Part B, and this year it's $174.70. That's the minimum that you can pay, depending on what your income is at retirement, or maybe people are still haven't retired. Depending on what your income, it can go higher than the 174.70, and that's your Part B. Now, unfortunately, with Medicare, they only pay 80% of the bill. So just because you have Medicare, only 80% is going to be covered. The cost is going to be covered by Medicare. You're responsible for the other 20%. And with that 20%, it can get very, very costly. Example is if you had fallen for whatever reason, unfortunately, and had to do a hip replacement, and that total bill came up to $200,000, that 20% of that would be $40,000. And that's going to be your responsibility. Now, you won't have to come up with it up front, of course, in some cases, but you will have to make that payment on there. And you can make payment plans, but that's $40,000 that you're already now in the hole. What if later on, a month or so later, some other incidents comes on? Again, you adding on to that 20% to that $40,000. Because of that, people was having to file bankruptcy and couldn't afford Medicare and was having problems just trying to live because of, unfortunately, health situations that they had no control over. With that happening, that's when they came up with some options for you. It's a supplement plan, or you have an Advantage plan. I just also want to introduce the Medicare and You book. Are you seeing that on the screen?
Yep.
Okay. You should be getting this book in the mail. This is 2024. You should have already gotten it in the mail. And if you haven't gotten it, you hopefully 2025 that we're sending you one updated. This is produced by the Center of Medicare Services, Medicare Medicaid Services. You need to do this is what the guidelines of what Medicare will pay for and what their responsibilities are. So you use this as a guideline whenever you selecting the carer or whenever you're going on to Medicare, you understand it goes through and explains all the things we're talking about today. But again, we're trying to get into the weeds, and sometimes it's like, oh, that book is too big, too long. I don't feel like they put me to sleep, on and on, or whatever. But you don't want to throw it away for sure. I just want to make sure you understand that. You want to use this as a guideline. So this book talked about the different other options. Again, you have original Medicare, or you can select a supplement. Now, what a supplement does, and I like to use the illustration, is a supplement allows you to fill in where original Medicare doesn't pay. So I'm using this as my hand as example of what original Medicare looks. And you see all these gaps in between, right? And those are representing, to me, that's representing the gaps in the charges that Medicare doesn't pay for. Because the Part A, even though it's no cost to you, it's deductibles that need to be met before a Medicare would kick in and start paying. So what a supplement, or Medigap as people would know it as well, it actually fills in the gaps. So in terms, but you still, the key thing with a supplement is you're still in control and have the key to your medical choices, medical health coverage. And that's what the key thing is. This is what this little tag is saying, that you have quality, you have the opportunity to select quality coverage anywhere in the United States and sometimes out of the country as well with a supplement. So in terms, you want to look at that as an option. Those options, the window for original Medicare for a supplement is normally when you first get onto Medicare, you have an 8-month window of selecting, do you want a supplement or do you want an Advantage plan? It's very important that you understand what a supplement can provide for you. If you got chronic illness or major problems, a supplement might be a better choice for you. Now, I'm not saying it won't be costly, but it might be a better choice. At least look at it, at least consider it. Don't just walk away and not knowing what you're walking away from. Now, on page 76 of this book, it talked about the supplements. So it's on page 76 right as of now. When the new book comes out, it might be different, but these are the different plans that you can select under a supplement. When you have a licensed agent, you will want to have that conversation with them prior to anything else to understand the difference of what your options are. Again, before you walk away from something, it's very important. So like I said, with the supplement, you get to go quality care anywhere in the country, wherever doctor or facility accepts Medicare. You can select that plan and be able to go and get coverage. I had a guy who had very rare diseases and problems. He would go to Nebraska, he would research and find out the best doctor or surgeon all over the country and would go and get services all over the country. So he got top-notch service. Again, it's at a cost, but sometimes, again, this is your life. So sometimes you want to make a sacrifice to at least look at that as a possible option. Supplement doesn't offer a lot of other bells and whistles that the Advantage plans do, but then we can talk about that down the road. Okay, and then the next option is the Advantage plan. Everybody knows about the Advantage plan. Would you say that?
Oh, yeah.
Okay.
They're very popular.
Very much so. And
a lot of $0 premium plans when it comes to the Medicare Advantage. So that's, you know, and like the bells and whistles that you were talking about, those are pretty
very common, right? Yeah. The dental, vision, and hearing amenities that are offered, things. So that's totally inclusive. Unfortunately, with the supplement, those are totally separate from what the Advantage plan offered. But in turn, when you select Advantage plans, so I'm trying to tell people, yes, you have all that great stuff available. And what they're doing on TV, they're dangling all these extras.
Yeah, the carrot.
Right, the carrot in front of you, the food cards and all over the counter or whatever. But they're not telling you what you're not getting when they're offering these things. And that's why I say, when you come to Advantage plan, it's a question mark. That is very important that you understand when you're going to select an Advantage plan, that you know what carrier is going to be the best one for you. You want to talk to an agent like Kerryn and myself, that we're brokers. We service more than one particular carrier. Because when you just have one carrier, the agent just service one carrier, of course he's going to lean you or direct you towards that carrier.
Right.
That might not be the best carrier for you, depending on what your drugs you're taking, what type of hospitals, what networks you're in. It's very important that you understand the selection you make, because that's going to be something you're going to be stuck with for a while. And if you don't have the right plan, you can be very costly and get in a lot of trouble with that. One of the key things that's coming up this fall, it's going to be at the end of the month, the carriers by law are required to send you out what they call an annual notice of change, ANOCs. And what that does is they're required to show you on one side of the page all the plan that you're on now. And then the next side of the page is what they're projecting or what they're suggesting, what plan or the changes to the plan that they're saying for 2025. Read that very closely. It might
benefits change every year.
Yes.
They give more, they take away. Maybe the prescription that you had that was covered at no cost last year is going to be some cost this year. So it changes every year. So it's important to look at that and compare.
Right, do a very deep comparison. So again, a lot of things are changing. One of the major changes, we'll get into it a little bit later, is the donut hole. I don't know if people are familiar with the term donut hole, but it used to be where your maximum coverage on your medicines were $8,000. Well, that has been closed. So people are just shouting, oh, great, well, yes, how do you go from $8,000 down to $2,000? Who's making up that $6,000 difference? Who's gonna cover that? That's the big question. I tell people every day, insurance companies are not in the business of losing money. So once you wake up to that fact, you got to realize that $6,000 is going somewhere.
Right.
I'm not going to say to who. Somewhere, and I'm not going to
find out.
Right, exactly. We won't say they're eating it all. I doubt that very seriously. But that's why this annual notice of change form is coming. They have to send it to you. Read it. Don't go by what the commercials say on TV. Oh, we're giving more. Trust me. They're giving more by taking away other things, something else. And they're putting it in places that you have to dig it out.
When is that supposed to come out?
It should be out by the end of this month, the end of September. Definitely, because going back, we're going into what they call the annual enrollment period, AEP. We talked about page 7. AEP is coming up. And that starts on October the 15th through December the 7th. That's when you can actually officially enroll into a new plan. We as agents can talk about it on October the 1st, but you cannot officially enroll until October the 15th. Don't run out and say, oh, I'm gonna be the first one to enroll on October the 15th. You need to make sure you're with someone that's helping you shop and understand what those plans are about.
Take the time.
Please take the time. Do a list. I'm asking all my members to do a list of all your medicines and all your doctors, and let us do a thorough research of what plan is going to be the best and make the most sense for you. A lot of the plans are not giving talking about implants anymore, other things, coverage that they were giving.
They're taking it away.
Taking away, closing a lot of other things, and it's due.
Grocery card benefits are changing.
A lot of things. We're not by law. We cannot go and tell you the details right now. We can't officially talk about the prices and things until October the 1st. And like I said, with this particular recording, we're just talking about the educational purpose of it. So we're really digging into helping to understand what to look for. Don't think that letter of annual enrollment, annual notice of change is just junk mail. See, a lot of times people just think it's part of the junk mail. And I think sometimes the carriers might want you to think that.
Well, because they send you a bunch of other stuff all throughout the year that actually usually is junk mail.
Exactly. So in turn, oh, you just get it. Oh, it's not important when this is actually very, very important. Oops, upside down. But it's very, very important that you take time. And if you don't have an agent, you suggest Kerryn or myself that you reach out to one of our companies, and we'd love to be a part of that conversation. Jim, you can put it in your text, in your chat box later on, or information, so we could be able to be reached out, okay? Of course, you can contact the Marion County Coalition of Aging. They as well could be able to get in touch with us as well. So we talked about the original Medicare. You can stay with that. Original Medicare does not have a drug plan. By law, you must have a drug plan within 63 days of your Part B effective date. So if you don't have a drug plan,
you have credible coverage.
Right, unless you're with an employer and have credible coverage through other means.
I get that question.
Right, exactly. You have to have a drug plan. So in turn, or if you don't, there will be penalties that you can sustain. But we can help you talk about that. Again, these are the agents that we know ways around that, how to be able to address those and perhaps help you with that. So we have the original Medicare with a drug plan. You have a supplement that actually allows you to cover what original Medicare doesn't cover, but you would have to purchase a drug plan separately, as well as with the supplement, you have to have, or Medigap as people call it, you will have to have a separate dental, hearing, and vision plan as well. And then you go back over to the Advantage plan, what people are so familiar with, you see that all the time, all over TV, and that's the A, B, C's, and D's of Medicare. In the Advantage plan. Okay, so
it's like a la carte.
Right, exactly.
You pay as you go.
Exactly. So unlike the supplement, you pay up front and it covers a lot of things. That's
like
what
pays,
right, a buffet, but it's covered. You pay you pay the flat fee up front, and then it covers a lot of things. That's what's page 76 of this book was telling you of all the different plans. You have to qualify for different plans. There's certain things, requirements that you have to plan, to follow different ones. People familiar Plan F, but that's a restriction on that. Plan G is another popular plan. And then also a Plan N is another popular, but there's other plans as well. So again, if we know what your needs are, then we'll be able to help you and guide you on that. That's why it's important that we know your doctors and your drugs and things, so we'll be able to help you and understand what your needs are. And your needs are different from your needs of your husband, your spouse, your partner, your neighbors, your cousin, even though you might have some relationship. Each person is individual, and that's how we want to treat you as an individual and address your medical concerns.
Right.
Okay?
Very personal decision.
Yes, for sure. Okay, so we talked about the different options that you can have: original Medicare with a drug plan, supplement, with drug plan as well, and then dental, vision, and hearing separate. And you might even have to do that with original Medicare. Medicare does not cover the dental and vision either.
Right.
Unless there's some type of accident or something that's related, medically related. Then it turns into Advantage plan. So let's go a little bit further into the Advantage plan that we started. You had the A, B. If you on TV, they're saying, "Oh, do you have a C plan?" And everybody, "Oh my God, I need a C plan." If you have original Medicare A and B, and if you've already signed up for Advantage plan, guess what? You have C. A plus B equals C. There's another way they was tricking people to call that 800 number and to call in, well, give me your Medicare card. Let's give me your address, giving you enough information where they can switch you. And then they say, oh, you might qualify for more food and might qualify. And half the time they knew you didn't qualify, but they got enough information to be able to trick you as you called. And once you got their number locked in their system, that's how they're going to keep calling you. Oh, we're just following back up. Oh, we're just doing this. A lot of times, one of the other tricks that was used, and I don't know if you're familiar with this one. Can you hear me? Hello, can you hear me? Yes, I can hear you. Oh, can you hear me? I said, yes, I can hear you. You say yes enough times. They are required to put you on a recorded line. You said yes enough time. Well, they have slashed your yeses and have slid them in to the different questions. They said, oh, so when they get reported or complaints come in about them, well, Mrs. Smith said yes, because we got this recorded right here. She said, yes, she wanted this change. Yes, she loved our program. Yes, you're a phenomenal person. You know, in all reality, there was not that at all, but another way they trick people. So again, that's what you tell. I have an agent and hang up. Normally we ask you not to even answer the call.
Right.
But some people say, well, I just can't let my phone ring like that. I just, you know, if they call you and say, can you hear me? Can you hear this? Click up. That's one way to deal with that particular situation. So like I said, so you got A, B, and C. The Advantage plan, a lot of them, but you got to check. A lot of the plans do include D. And D stands for
drugs.
Right. So drugs, but there's many ways that you can describe a drug plan or drugs in general. Medicare, I'm so upset of how they're trying to make it complicated, but they can talk about formulary, they can talk about tiers, they can talk about generic, they can talk about brand name. They're all talking about
generic, preferred generic. Yeah. I mean, it gets really hairy when you start getting into those prescriptions.
Right. But at the end of the day, guess what? They're talking about your drugs, the medicines that you're taking. And then sometimes you want to talk about the supplements as well, because they might not be covered, but you might be able to get it on over-the-counter issues or concerns. So I just like me as an individual, write down everything that you put in your mouth in regards to medicine. So we get a better understanding of what's going on. So we'll be able to, again, direct you in the right way. We can only go by what you tell us. We cannot sit there and look at you. We're not MDs by no stretch of the imagination.
Oh, no.
Oh yeah, even though they have us on taking all these exams and things, and I get certified every year, we still are not doctors in any situation at all. Okay, so now that we're over in Advantage plans, we want to talk about the HMO versus the PPO. Would you feel comfortable in talking about that?
Sure.
Okay.
So with an HMO, those are the two different types of plans that you can do. You can do an HMO network or a PPO. The HMO, you typically do need a referral from your provider. It just would depend on the plan. And then the PPO side of it is you can go in or out of network. There would be a higher cost out of network, but you do have that option with a PPO Advantage plan to go outside of network. So, you know, you can travel with the plan and things like that. So it makes it easier if you are worried. If you see a bunch of different specialists or things like that, it can make it easier to navigate.
Yes, HMO actually stands for the Health Management Organization, and the PPO is Preferred Provider Organization. So that's one of the difference. Like Kerryn was saying, HMO, you're very restricted in regards to where you can go. They sometimes have to give you referrals if you want to go outside of that area network. They try to loosen that up not as much as it used to be, as restricted it is.
Right.
But if you use an HMO and you go outside the network, guess what?
That's all you.
Yeah, that's 100%. That builds your responsibility. So it's extremely important that you ask ahead of time, do you accept this plan? And take notes. Write down who you spoke with, because he might take it today, but when you go to get the procedure, that might have been something that was cut off or no longer being accepted. And it happens several times. Or are you in the middle of a surgery or procedure and you go in and the anesthesiologist gets sick that day, and then it turns, you have a replacement. That particular anesthesiologist might not be in network, but you had already documented that the one that you had assigned that was in network. If you don't appeal that decision, you might be responsible for that bill. So it's very important that you took notes up front to show that you did your due diligence and prove that you had everything covered and that you had no control, that the anesthesiologist changed. Another point that I like to bring out is 70% of the denials are never, ever appealed. So, and
they're expecting you to just let it go.
And just pay the bill,
Just pay the bill, make a payment plan and move on. You don't have to do that.
Yes.
And that's why it's really nice too, to have a licensed agent to be on your side and to back you up and to help you fight these issues.
Right.
Fight these bills that you do not need to pay.
They're not legitimately your responsibility. You need to make sure that you're doing what you're supposed to be doing and that the insurance companies are doing what they should be doing.
Right.
So it's very important that you keep that in mind. Take good notes. And again, like Kerryn said, as an agent, it's amazing how I've gotten on the phone with the billing department, and it's amazing how that bill just seems to just dissolve and go away.
Yeah.
You know, my clients have been working on it for months trying to get, no, Miss Smith, you still owe that. No, we don't show that it's covered. And we no. And I said, well, I show on page number 23 of the summary of benefits. I left her in the plan I have her on that this is covered.
Oh, well, it is. Imagine that. It's covered.
Yeah, they knew it was covered the whole time. But once you start paying those bills, they're going to start pushing them through. And then until you start getting a bill that's too costly, and then all of a sudden now you're calling me. Well, you should have been calling me on a $5 bill. Because now there's $500 bill, it makes a difference. So don't pay none of it unless you know it's a legitimate cost for you. Okay, going on. So we talked about the A, the B, the C with the drug, and the D for the drugs. Now we're talking about what other amenities that these Advantage plans are offering.
Okay.
We want to talk about, most importantly, your dental, vision, and hearing first. We'll get to the other things because they've been dangling all over TV for you. Yeah. But we want to realize that dental health is just as important as physical health. That if you have a mouth full of rotten teeth, that is blood poison. It's going into your blood system. A lot of these plans are offering dental services. Why are we not taking advantage of it? We need to be taking advantage of it. And that brings up another point that I kind of didn't skip over. In this book as well, there's other preventative services that Original Medicare offers, several, about 10 or 11 preventative services that they already offer just by being on Medicare alone. Say, for example, your mammograms, your prostate exams, your what I'm trying to get out, colonoscopy. I tell people every day, boo-booing on a stick and mailing it in is not a true colonoscopy. Because unfortunately, if they're finding blood in your stool at that point, you're way past stage 0 of that disease. And stage 0 or below is a lot better than stage 4 of any disease. It's cheaper to keep you well than to get you better.
Right.
And that's why they're offering these preventative services. Take advantage of them. They have you going to the doctor, the services, be it a PPO, be it a PPO, or be it an Advantage plan, be it a supplement, or be it original Medicare. You can go to your primary care physician, PCP, at no cost. Majority of these plans now, let's see what next year is going to bring.
We'll see.
Right, exactly. But as of now, these PCP visits to your primary care physician are at no cost to you.
It usually stays around that.
Right. We're hoping that it does
We're
stay.
hoping it
Right,
does.
exactly. And then when you go to your doctor and you have a concern, or they're telling you about these preventative services and want you to do lab work, that lab work is also at no cost. It used to be back in the day, lab for $5. But first of all, it started off, why don't you go to the doctor? You had this pain for all these years. I couldn't afford to go to the doctor. So they took that away. Now it's $0 to go to the doctor, your primary care. Okay, so you go to the doctor and he wants you to do lab work, blood work and things, urine analysis and things like that. How they're again catching things way ahead of time. Why did you get that done? Well, it's only $5. I don't have $5. Okay, you just bought a $30, $40, $50, $100 pair of shoes, but you don't have $5 to go to the lab. Okay, fine. They took that away. So between going to your primary care physician and getting lab work, we're catching a lot of these diseases or a lot of these issues up front. So we won't have the issues going down the road. Again, it's cheaper to keep you well than to get you better. So that's one of the things in regards to preventative services. And then I went on to say that dental, vision, and hearing. If you have a diabetes, that's where the vision comes in. A lot of them gives you free vision where you can have your eye examined at no cost. And then even some of the lenses and glasses, they give you extra money to buy those. It might not be the most fanciest glasses.
I don't know. Some of the vision packages are pretty
good.
Yeah, they're pretty good. You could get some pretty nice glasses.
Exactly. But again, so you got that, your hearing, so all these are elements in which they're already, people are complaining about what they don't have, but they're not taking advantage of what they do have.
Right.
And that's part of what we're trying to have this education with. Things are going to go up. A lot of changes are coming. But at least look at the things that are available to you. And really this year, before the changes come.
Get to know your plan.
Right, and know your plan. I'm saying even going to your doctor and saying, okay, the surgery might need to come up, or this procedure or something, or I got lab work that says that my blood sugars are higher than it should be or whatever. What can I do? What should I do to be able to bring these things around? Have those conversations. And if you don't have a doctor that you feel you can have that conversation with, find someone that you can, a doctor that you can, or an advocate that feels comfortable to go in there with you. Maybe the doctor's not hearing you. Maybe the doctor's talking way up here. Have an advocate say, well, can you break that down? Can you make that more explainable? Can you help me understand that? Again, stand up for yourself. This is your life. This is your health. You need to speak up or have someone, a niece, a grandchild, a neighbor, a girlfriend, somebody you feel comfortable enough to go in these doctor's office and to actually ask these hard questions so you will be able to be taken care of correctly. So like I'm saying, if you go now, we still got until the end of the year before any changes need to happen. So we'll know what your actual needs are, because you might be fine now, but if you're getting all these services done, that's how they're catching things. Your blood pressure might not be as stable as you think it is. It might not be on the right medicine. You might have to be switched and everything. So that's what we're really trying to help you to understand and take advantage of the things that are free at very low cost or at no cost. So we'll know when we go into 2025, we're going in there prepared.
Right.
With a
ready for battle.
Right, exactly. with a game plan and saying, and this is what I'm going to do different. And part of that too is we got to step up and take responsibility. We definitely for our own health. No longer is the doctor going to be able to say, well, I know you're trying to quit smoking. You need to try to quit smoking. I know you're trying to get your blood sugar. You need to look at, they got nutrition as one of the other services, a nutritionist. But to help you decide what diet do I need to get my blood sugar down. The medicines they got out there.
Diabetes management.
Yes.
Things like that. I mean, there is a lot to be offered in these plans and just in
Medicare in general. And so we as the aging population need to get on top of all this. but last but not least, we're getting up here to going into the end of the hour. But then we talk about the over-the-counter. Okay, those are the last thing that you want to be considered. That's the very last thing that you want to say, how much do I get? Because what is happening, what I feel, and this is the term I'm using, we are literally taking quality health care, quality health choices, and we're trading it in for Band-Aids and toothpaste. They're dangling.
That's so true.
They're dangling all this stuff in front of you. It's only so many toothpaste bottles you can have, only so many Band-Aids you can buy.
The grocery benefit. I mean, it's a lot of people will select their plan based off of that.
Right, but then your doctor's not even in network.
Right.
The hospital's not in network.
Right. They don't care though. They got their groceries. They got $50 in groceries. So.
Right, exactly. But again, what if you have to use an ambulance to go to the hospital? Oh, is that covered? Well, how much would that be? People are literally calling, having those conversations. I told you when I sit down with you how all these different elements and how much they cost. But the only thing you heard is, I got so much, I'm telling your neighbor, I got this. How much money you getting groceries? I got that, And what is it, and eating, I know you got to eat. I know you got to have quality
and
food.
groceries are expensive. It is a nice benefit to have. Don't get us wrong at all. It is an amazing benefit for so many people that need it, especially when it comes to our dual focus plans.
Yes.
When you have Medicare and Medicaid, it's really helpful.
Right, exactly. But most importantly, your overall health, your quality of your care health is the primary focus that we
needs
need
to be on the forefront. And then that grocery benefit and over the counter is just an additional bonus.
Right, exactly. And what I'm finding out is a lot of times they get into the grocery store and they're saying, oh, that's not covered. That's not in there. So they're dangling all this, getting you over there. And then half the time you can't use all the benefit anyway.
Right.
Or we're out of stock, or that's not the right size, or people are in line for 15, 20 minutes and the people behind you all frustrated. Because
you got a grocery cart full of stuff and
there's supposed to be healthy stuff that you thought it was. It wasn't. Last week it was healthy. And what happened? How did the orange go from healthy to unhealthy, in a week? But again, these are tricks that are being happening to us and programs that they're using against us that we need to be aware of. So stop getting caught up in the wrong things and make sure that we're using quality.
It is health insurance, so make it about your health.
Right, exactly. Right. Exactly. Okay, so we've been talking quite a bit. I kind of jumped through the slides. There's a lot of slides that I didn't go through. But again, I think
we covered,
right. We just didn't hit it particularly. But again, the original our annual enrollment is from October the 15th through December the 7th. That's one of the things we talked about and want to make sure that they got that importantly. You pull that one. Oh, yeah.
That one?
Right. Just put that in front of them real quick.
Well, I will say that, I started off on the Advantage plan because it looked pretty exciting and pretty cheap and all that kind of stuff. And I did it for 2 years. And my problem is I hang out with all these senior services providers, all the time at all these events and lunches and things, and heard too many stories about getting denied for, like for rehab and for in-home health and all these kind of things. And I care for my 86-year-old mom and my 94-year-old uncle who, just with that, they're walking this tightrope all the time of being capable of staying in their assisted living, or if they fall off of it, then they're in rehab for a month to 3 months. And and I know one cycle, mom didn't get the required 3-night stay. I know solutions for that now, but that was a $36,000 a month out of pocket.
Ooh,
So it's kind of one of those things that I became aware. So I decided to, I'm healthy, and I decided to jump back into the standard plan. I was able to do that, and so
the supplement, right? Yeah. You had to go through underwriting, correct or incorrect.
Well, I don't know if I did or not. It went through without.
You just got back on, okay.
Yeah.
And that's what we're trying to say. Normally, the first 8 months, or the first year, 8 months for sure, that with a supplement, when you first sign up, you have to make that decision. Do I want a supplement or do I want an Advantage plan? after that window closes, then you are responsible to go through underwriting, similar
To
with
get
the,
back in.
right, to get back in, or you have the
Well,
option of having a supplement.
I'm sure I did. I was 2 years, but I didn't,
Okay.
you know.
Okay, exactly. So again, so that's one of the things. And then like we talked about, where now they close the donut hole, you're going through a maximum of going from a maximum of this year of $8,000 for your medicines down to $2,000. So that's a $6,000 difference that you definitely will be able to, that they're gonna make up the difference. And that's why we need to be very careful. Like you said, you realize with your mother and going to a skilled nursing home, a nursing facility, for rehab. Okay, so you have to stay in the hospital for so many days before you can go over it. Read to make sure those 3 days is still the rule.
Yeah.
Make sure you're reading. Is staying in the hospital, you paying for the first 5 days, or is it more longer?
Mhm.
Is the cost per day, has that increased? Read the fine print. Because they're gonna hide that $6,000 somewhere. And you want to make sure that you're not getting impacted the most by that money. It's going to go up, so just go on and hold on to your seat and just get ready for that. But how much of an impact are you as an individual going to have to take? And it's by you making a wise decision and selecting the plan that works best for you.
Well, I think that people don't realize too, you know, you're 65, 70, whatever it is, and you're looking at all this stuff, and the idea of being, you know, in a rehab facility, you know, once a year or twice a year for an extended period of time never even seems possible. When you're
Yeah.
dealing with people in their 80s and 90s, it's not only possible, it's just pretty much standard part of, you know, your year, you know, so, you know.
For sure.
Yeah, I mean, we don't have a crystal ball. That's the hard part about it is, we don't know how our health is going to be in the coming years. We could be great, nice, healthy right now, and then in a couple years, God forbid, something happened. But it's just something that you've got to think about when you're looking at those options and weighing, do I want a supplement? Do I want an advantage plan? You just gotta, it's just going to be so personal and so different for each person.
Or would original Medicare work out best for me?
Yeah.
Right, exactly. You want to say we can't really talk about it, we can't promote it, but if you get caught into a plan that you don't like or got tricked, you do have options. So call the agent and we can help you with some options available. Like I said, by law, we're not supposed to promote the options, but that's another thing is good to have.
Promote ourselves as helpers to you.
Right,
because
exactly.
It is nice to have somebody in your corner to fight for you, to answer those questions when they come up, and to make sure that you have a good understanding of your current plan and then your other options when it comes to that, when it comes to annual enrollment, open enrollment, and things like that.
Well, it's just like so many other things. It's like, don't go in alone. You
Right,
know, it's
exactly.
like, this is, and it's not, I mean, I would say with Medicare, absolutely, Medicaid waiver, absolutely, you need someone there that kind of guide the ship, right?
Right.
And that does this every day, as opposed when you're looking at all this stuff that really, my son owns an insurance agency. None of this stuff makes necessarily any sense to him, even, so it's not what he does,
Right.
So, so he can read legalese and stuff, but it still is not, it's not his.
Yeah, if you call me about your car insurance, I can't help you, Jim.
Yeah, exactly. So it's kind of, it's the same thing with, like when you're trying to navigate through like VA attendance and Medicaid or the waiver programs. If you don't contract with an elder law attorney, you're costing yourself so much more than you're going to pay them. So
Right.
and with a guide in the insurance agent, we're not paying you anyway. I mean, it's coming out of from whatever company you work with. So
Exactly.
So it's not coming out of pocket. And
Right.
I'm an advocate of paying whatever amount of thousands of dollars you need to for that elder law attorney, because it's going to save you many, many times that through the process. So,
And you brought up another good point, Jim, is the services we provide are at no cost.
Right.
So if somebody's sitting there trying to charge you, even though we've been back and forth to your house 2 or 3 times, then you need to question that in itself, because what we provide and the services we provide is at no cost to you. So they shouldn't be charging you at all. So that's what you want to take in consideration if somebody talk about is at a particular cost, especially if that's what they're doing is selling you and talking about Medicare. Again, another thing is if they come to your house and they get inside and they want to sell you life insurance and other things, annuities, that's totally outside of the realms and what you're supposed to do as well. So they're breaking the law in a lot of these situations.
There's a lot of compliance that goes into it, and there's a lot of, red tape that's put there for a reason.
To try to protect us, so
Right.
protect the elderly as well. So need to keep that in mind for sure. Don't just let anybody in your home or just go by anybody. Make sure you have a reputable person.
Mhm.
Well, very good. Well, thank you so much for coming and sharing with us today. I'm excited about this. This video is it's going live right now on Facebook Live on our Life's Co-Pilot Facebook page. It's also on Zoom, but we will record this. It'll go on our website. It'll go out into our, I'll send you guys a copy to do with as you please. And then I will also, it'll end up in we have a newsletter that goes out once a month. And it will go out to, I think it's like, I don't know, 13 or 14,000 emails that will go out to. So we're trying to get this word out to some people. I mean, that's the whole, Life's Co-Pilot is a passion project. And Kerryn Transitions, we help people downsize and do all the things that go along with that, and estate sales and online auctions. So we're dealing with that senior client and their families on a daily basis.
Mhm.
But also being the only sibling that stayed in town, I'm dealing with that with my uncle and aunt, and my uncle and my mom every single day. And I know how hard it is to get this kind of information. It's hard to find it. And so that's why we created Life's Co-Pilot, to give a voice to the experts like you to talk to the seniors and their families.
Okay, before we go, Kerryn,
Love
we'll
that.
give your full name and your name of your company and your phone number
Yes.
to be reached, and then I'll do me later. Go ahead.
Yes, I am Kerryn Rodriguez, also known as Kerryn-Ehgott. I am just recently got married, so
Well, congratulations.
will be interchangeable. I'm with All You Need Insurance, and my phone number is 317-779-8158. You can call me, text me, just let me know what's going on, and I can come and meet with you, answer any questions you might have, or however I can assist you, I'll be there.
Great. And then my name is Pamela Perkins. I am with A Love Life Legacy LLC, and my phone number is 317-459-8072. And we both are brokers, so we represent more than just one particular carrier, several carriers.
Mhm.
So we'll be able to definitely help you and definitely answer your questions. And if we don't know the answer, we'll do the research and the due diligence to find out for you.
Yes, we will.
Do me a favor, send me, you're going to send me those sheets anyway.
Right.
Send me both of your, I've got your card sitting here in front of me, but Kerryn, send me your email as well. You just send it to my jmorgan@kerryntransitions.com.
Okay.
And then I'll put those on the video, so.
Okay, perfect.
Sounds
All right.
great.
Well, thank you so very much. Enjoy your
Thank
day.
you.
It's
Thank you so
absolutely
much,
gorgeous
Ken.
out. Huh?
Yes, it is.
It
Thank
is.
you.
Thank
guys.
you.
All right. See you guys later.
All right. Take care.
Bye.
Bye-bye.